I'd like to welcome everyone here tonight. My name is Barbara Grosh. I'm president of the League of Women Voters in the Rochester metro area. The League is a nonpartisan political organization. Our main focus in life is making as many well-educated, well-informed registered voters as we can and getting them out to vote. But we do also take positions and lobby on various political issues. And in the past year, we've been revising our position on policing, which dated from the 70s. And that's how we got interested in the whole area of how police handle mental health crises. So I'm very happy to welcome the panel that we've got here tonight. So let me go down the list and introduce people. Our first speaker will be Alia Henton-Williams. Ms. Henton-Williams is the manager of crisis intervention services for the city of Rochester. So that's a division within the Department of Recreation, I think. And under it is the PIC unit, the person in crisis unit. The next person will be Leslie Gordon Ogden, who is a manager in the PIC unit. And then we'll have Mary Lupian, who's vice president of the Rochester City Council, and she was an early advocate for the creation of the PIC unit. And then for an outsider's perspective, we're going to have Andy Carey. Andy is with the MC Collaborative, which is a local group that helps all kinds of people, but a lot of mentally ill and homeless people to navigate the system and find what they need. So we invited Andy because we were pretty sure that he sees the kinds of problems for which people might call the PIC unit, and he might be able to give us some outsider comments on what needs are met and not being met and how it's all looks at a street level for those who are more deeply involved than most of us are. So for background, I'll say, I guess a little over a year ago, they did a study. They looked at the 911 logs for the previous year, and they found that half of the calls to 911 really don't belong with the police at all. There's no crime going on. There's no weapon present. A lot of times it's a mental health crisis. And so they decided they could divert those calls to a unit if such a unit existed, and they created it. And those units are, I guess, primarily social workers, but we'll hear from our insider speakers on what the PIC is like and what it's been doing. So the questions that we have are like, how's it going? Have we solved that big problem that led to the disastrous night with Daniel Prude, or are there big unmet needs that we should still be thinking about? How's the funding going? Is it housed in the right thing? All those kinds of issues that the League likes to get involved with. So I have a few announcements. So I think we've turned off the chat. If the audience has questions, they're encouraged to put them in the Q&A. The format we're going to do here is that the first we'll go around the circle and let everybody have 5 minutes to talk about how the PIC team looks from their point of view. Then we'll have questions. I have some questions. I hope the audience will put in some questions, and we can have some back and forth between our panel members. We do have closed captioning enabled, so if you need that, you can show the captions by clicking on the CC button on your screen. We are recording this event, and we will post it on our YouTube channel in the next day or two. So anyone who's registered will get a link to it, and feel free to share that with your friends or anyone who missed it tonight. Okay, I think that is it. So I'm going to turn it over to Alia Henton-Williams.
Good evening. Thank you so much for having us here with you. Again, my name is Alia Henton-Williams. I'm the manager of the Crisis Intervention Services Unit. which is out of the Department of Recreation and Human Services at the City of Rochester. Our commissioner is Dr. Shirley Green, and our deputy commissioner is Sarah Fletcher. I'm not sure how the flow of this is going to work, Barbara. If you want, I don't know how you want me to start off. Am I just going to give a brief description first and then we'll go into questions? You're on mute.
Give us an overview of what the PIC team's doing. How big is it? How much money are we spending on it? Does it make sense to you that it's in the Department of Recreation? Everything you'd like citizens to know about the PIC unit.
Sure. So I will give an overview of the team and the work that we're doing and have been doing. The PIC team was created in about September of 2020. So we are a little over 2 years old now. Our team is comprised of emergency response social workers. We currently have about 24 team members. Mayor Evans and City Council were very gracious this year to increase our funding so that we were able to expand the team, so that most of our team are full-time staff, and that has helped us to be able to be more efficient, to build our community partnerships, to increase our numbers, our availability. And so that increase in funding has definitely been beneficial to the team. We are a 24/7 team, 365, we do not close. The PIC team is one of 3 teams that falls under the Crisis Intervention Services unit. We're all intertwined, we all work together. The unit in and of itself does not close. And so the PIC team is staffed by those members who have that kind of availability and flexibility to be able to provide services, so that we pretty much consistently have 2 teams that are working. Our numbers are a little lower during the overnight hours. So during that time, we are able to have 1 team that is working. We respond to many different types of crises. We started off in the beginning just responding to about 3 different types of calls. We feel grateful and blessed that since that time, we have grown to be of value to the police department. And so we're called out for various types of calls now that go well beyond the initial 3. So at this point, we feel that our work has been extremely impactful, and we're continuing to grow the work, to grow our engagement and outreach with the community, and to make sure that we're responsive and providing quality, effective work to our community members.
You're on mute again.
Sorry. Now I'm going to welcome Leslie Gordon Ogden. She's a manager in the PIC. I'm not sure if it's a manager or the manager of the PIC team. So could you talk to us about what it's like being in the PIC unit? What's a day in the life look like? What kinds of calls do you go on? What's the reception? How do calls get routed to you?
Actually, I'm the supervisor.
That's what I thought.
Supervisor. Yeah, Alia is the manager of the crisis services, and I am one of the supervisors on the evening shift.
Okay.
So basically, your first question is a day in the life of the PIC. Well, like Alia said, PIC is like a 24/7 response. We respond to a variety of mental and behavioral health calls. So no day is the same. Each day brings something new for PIC. So we can't say that we have had the same 2 calls ever. How our calls are being dispatched is 911. I'm just using them because we're getting calls through 911 and 211 as well. And 988 is an additional one that's fairly new. Our calls are being dispatched through 911, and they're being assessed through 911. They are the ones who determine if our PD is to be put in on our call. If once they do their assessment, they will determine if it's a pick a loan call. 211 does the same process. They'll send us the call. Once we do the assessment after 211 sends over the information to us, at that point, we would determine if RPD needs to be added to the call. For example, there's calls where someone may be just homeless. They're not violent. They do not have a weapon. They just need a place to go, a shelter. Those calls can be a pick a loan call. Where to provide resources for those individuals. Calls that require RPD is if they are, if they pose to be a danger to themselves or others, we will have police come and deem the scene safe for us, and then we can come in and handle our business and provide resources and services at that time. If we do go on a call and we feel like we need to add RPD, say it be an individual is escalated, punching holes in walls, whatever, we will add RPD to the call because what we found out is that we have to make sure the PIC team is safe at all times. And we use that as our forefront. We have to make sure our staff goes out on calls. We want them to do an excellent job, but we want to make sure that their safety is first and foremost on every call.
Okay, so when a call comes in and a team goes out, how many people are on that team?
We have 2 teams per shift, so that's 4 people. Only 2 people respond to each call. So we have to go out in pairs. And once we get out to the call, our team will do an assessment, and then we will provide the needed resources, say it be even just having a conversation, active listening. Sometimes we have to use our de-escalation skills for that person. If a person says they want to go to the hospital, we cannot deny them. We have to call the ambulance to send them to the hospital. But our first thing is to try different coping skills and let them know that there is alternatives, besides the hospital and jail. And if it can wait until they talk to their primary care, the next business day, we will try that as well. So we try to deter them, but we don't like stress it. If they want to go, we will let them go to the hospital.
So is that enough people? 4 people on the shift at all times and less night?
Actually, it used to be less than that. We used to have 2 people, so 4 people. We've been handling the calls. Right now, we're getting probably, I would say, about 150 calls a week. We're running a 24/7 shift, so that kind of adds out to about 15, 16 calls a day. So we've been able to handle the call load that it is. If it's necessary to add on more staff, and once it's approved, for people that's beyond my pay grade, then that will be it. But right now we are handling the call log as it is right now.
Okay. All right. Let's flip over to Mary Lupian. Mary, you've been a champion of having non-police response to non-criminal, non-dangerous activities all along. Can you tell us from your point of view, how's it going? What are your thoughts?
All right, and I'll start by kind of talking a little bit about the history of how we got here. So, this conversation really started in June, end of May, June of 2020, when George Floyd was murdered. And the community was really thinking about critically what calls do police need to be on, and what calls can be answered by trained professionals. And so we started the conversation on council, and I'll be honest, I think there was a little bit of skepticism. One of the only models in the country at the time was Eugene, Oregon. That's a city that's very different from our own. But we did host a forum. Senator Summer Brook and I hosted a forum on mental health response where we pulled in experts from Eugene, Oregon, and some other folks that were experimenting with the program at the time. And that was kind of a jumping off point where we started to learn about it in the community. But then, of course, we had Daniel Prude, who was killed by police. And that's when the conversation really started to heat up in earnest. And we were looking for how can the city respond with mental health professionals when someone's having a crisis. At the beginning, we were looking at the FIT team, which is the forensic intervention team at the county. But the way that they worked at the time would not have prevented Daniel's death. They weren't 24/7. They were only called out by police. So there was no kind of co-response dispatch. And so the city decided to form their own. And it was a really bold move and really leading the way. We went from idea to implementation in 3 months, which in government is unheard of.
Mm-hmm.
Even when we all agree, it sometimes takes 6 months to a year. So we ramped up really quickly. We were part of the county's Office of Mental Health 90-day task force. And so we were working closely with the county, but they were really hesitant to go to this model. And so, we kind of led the way. And now, 2 years later, FIT is also 24/7. They have increased their staffing. I believe they're, I'm not sure exactly to the degree of which they're co-response, but I think that there is that capability. And they're responding to calls outside of the city of Rochester, and the PIC team is responding to calls inside the city of Rochester. And we funded this through the use of the American Rescue Plan Act funds that we got to recover from COVID. And, in terms of funding, council has been very willing to fund the team, at the level that they need. However, when this funding runs out, we're going to have to find another source of funds. And so one of the goals for the future is there's some talk at the state level of introducing legislation to make mental health crisis Medicaid reimbursable. So that is a sustainable source of funding for crisis teams, potentially all over the state. In addition, there is a bill called Daniel's Law that seeks to institute state and regional councils and response models. And we'll talk more about this at the end, but there is an advocacy day on Wednesday where folks are going to Albany to advocate for that to be passed. And I think what the goal of the team had been at the beginning was to continue to diversify calls. The 3 call types were, I believe, mental health, suicide, and suicide threatening nonviolent. And the team has diversified, especially the calls that are coming from police, but to look at what other calls other cities are doing, wellness checks and homeless, and what else can we diversify. And to that end, I'm hoping next month we're going to pass the funding for a true 911 study. We didn't really do that study in the beginning. We just kind of looked at the call volume as what it's called a 25 card, which is just how these calls are coded for the emergency department. And the true 911 study is going to go into the narrative of the call. So what's said, which responses are triggered, which responses might we want to have in the future, even outside of mental health. Other cities are looking at, writing reports, noise complaints, neighbor trouble, things like that. So we're really looking at expanding our alternate response and also ultimately reducing the number of calls that RPD needs to go on.
Okay. Thank you. So Andy, please unmute and talk to us about what you're seeing.
All right, thanks. My name's Andy with MC Collaborative, like Barbara said. We do a lot of community work. So we are and it tends to be with the most marginalized in Rochester. So a lot of mental health issues, substance use issues. We do walking outreach in different neighborhoods all week long. So like on Tuesdays, we're in the Lyle Ave area, Wednesdays, Jefferson Ave area, Thursdays, North Clinton. Friday, we do a little bit more targeted. And so we're meeting a lot of people that are out on the streets or really insecure in their housing, facing lots of issues. We also do the social work for a larger shelter system with Reach Advocacy and now Project Haven. So we get in touch with PIC probably more so at that point of access in the evenings and at night would be something like our shelter monitors would call when they couldn't handle a situation. And PIC would respond. I've been lucky enough to work closely with Alia, working with the crisis case management team, which is really exciting. Because I think that's what we see most of is that PIC and other fit, ourselves as well, you know, having the tools to effectively have a crisis team in Rochester is really tricky. So, you know, with hospitals are stretched to the limit. So, you know, getting people into emergency rooms that might turn out to be a worse situation for them than just staying at home or having some sort of street level work is obviously a huge barrier. And then just the mental health system in general. A lot of folks aren't willing to go into offices. Staffing is, you know, slowly dwindled at a lot of places. There's long waits for appointments and stuff. So we're sending Leslie's teams into situations that sometimes are a little untenable. You know, like you go and you want to help people and you do your best to talk people down and figure out what kind of supports they have. But then the broader system isn't supporting all that hard work. So then you're kind of stuck. And that's what I think we see a lot on the street. So, you know, we're trying to be innovative and working in collaboration with everyone we can to help meet people's needs right where they're at, or at least right in their community. So I hope we continue to focus on that as well. Because I love the concept, and I know RPD loves it too, of not responding to a lot of things that they're needed elsewhere. And they're not trained to respond in those things, and they're well aware of that. And
Right.
So I think that whole shift in thought has been wonderful to see too. I talk with a lot of officers, and they appreciate having a PIC team, a FIT team, you know, other people to help them out. Now I think we just have to figure out the tools for the PIC team to use as a community. And that's the way we kind of see it from the ground level. We're lucky that we've been around since the beginning of PIC. So at the first summer of COVID is when we kind of took to the streets because we knew people weren't coming in for services and we had to go make sure we got people services they need. So we've been able to see a lot of its growth and watch it at a street level. And yeah, so I think that's a quick summary from me.
Okay, so you've said some really important things there. So a PIC team is person in crisis, and if we had better services and affordable housing and enough space in rehab programs, et cetera, we would have a lot fewer crises. So I'm kind of hearing both from Leslie and from Andy that it sounds like there is enough money to handle actual crises, but we could use a lot more money in all of the social services that keep people from having crises. Is that kind of a fair statement?
It does feel like that. It feels like, you know, PIC becomes kind of the triage unit for bigger systems, but they don't have anywhere to triage people to. You know, I mean, on occasion they do, but the reality is, so it kind of continues that cycle of crisis for a lot of people and makes it very difficult, their job very difficult, and everyone's. And I agree. I think a lot of what you mentioned is we need new and better treatment models and social services so we can really support people, especially when they're coming out of crisis. So if you manage the crisis and the acute symptoms are over, what's changed? And that's super important. We need to be able to address those things.
That is true, Andy. And also we need extended hours, because we noticed a lot of our people going through crisis is evening hours. And we have like limited places we can send them. I mean, you can send them to BHAC, but that's, 8 o'clock at its latest, and there's no other alternatives other than the hospital.
And the hospitals just don't have enough room to respond as well as
Absolutely.
we'd like. Is that
Absolutely, yeah. We just need more alternatives.
thinking back to Daniel Prude himself? He had been in strong like the day before, and they booted him back out onto the street.
I've talked to people that have stayed in the waiting room for 3 days.
Yeah,
And a doctor described it to me as the third world in the hospital. We have the Goldstein Children's Wing, but mental health isn't sexy, and so people don't fund it. And so there's just, we're building capacity on one side of the system, but the other side of the system, there's so much more work to do.
yeah. Well, I know somebody who was in the emergency room for 5 days because they didn't have a room they could admit him into. So, yeah, there's a lot of real inefficiency in that kind of balance. So going back, Alia, you mentioned at the beginning that originally PIC handled 3 types of calls, and that's been expanded. Can you say more specifically what types of calls and how is that expanded?
So I think one of the things that has happened is that we've seen such a huge increase in the number of PIC requests by police that over time it has caused the call types to increase, because it really shows that they've come to value us. And as social workers and mental health providers, I think they've become very supportive in our work. And so what happens is that we started off responding to mental health and behavioral health, and then officers were getting to other types of calls, 980s, which are death in the home, homelessness, as Leslie mentioned, domestic violence, sometimes family problems, youth trouble, just a number of calls. I think, we counted at one point and there were like 11 different types of calls that the PIC team had been requested by officers to come out and provide some type of support. And so, although we haven't formally expanded it, we don't want to leave our community members in need. And so if we are available and we know that we can offer services and support, then we will respond to those calls. We also partner with the fire department. So if there is a fire and unfortunately someone is deceased because of that fire, we've been asked to come out and provide support in those scenes as well. So there's a number of calls that have kind of caused us to have to expand our thinking, our work, our development, so that we can be more comprehensive in the services we provide to the community. And there are times where the police might start off at a call, and then they call the PIC team in, and then the police are off the call. Because again, our main priority, yes, is delivering service to the community, but as long as the PIC team is going to be safe, then we're willing to be there, and the police are willing to allow us to come in and do the work, as Andy mentioned, that they're not trained in, or where they could be somewhere for a crime, for instance, versus a call that is around mental health or behavioral health.
Okay, that's really encouraging that the police see the value in this. That speaks very highly of how the PIC team is showing up and how willing the police are to see that the PIC team's skills are valuable and that they don't have them. Makes me curious whether they'll want more of those skills themselves, because I would always think those would be useful. Of course, I'm in awe of social workers. I think all of us should get trained in social work.
We've been very intentional about the relationship that we build and continue to cultivate with the police department. I mean, it's a true partnership. It's very strong at this point, and it's something that we make sure we invest in, and we are talking, and we're making sure that everyone is kind of comfortable in their roles. We're asking questions, we're communicating, and we're making sure that that's happening on a consistent basis. And it has grown. It didn't start off that way. There were questions on both sides. There was hesitancy on both ends. But I think over time, we've learned to really work together. We've developed the processes, the protocols, and it has been impactful for our community.
Okay. Mary, I'd like to go back to something that you had mentioned. You were talking about long run funding for PIC since it was initially funded with ARPA money. And maybe Medicaid could reimburse it. So that's a state level decision, what Medicaid can and can't reimburse.
And I think that there's some interpretations of the Medicaid statute that would cover crisis response already, but it doesn't. And so, I think the idea is to create legislation to be very explicit about that, so that municipalities can get reimbursed for crisis response.
So that's a matter for the New York legislature or the US?
The New York. Yep. And I actually, I don't want to put her out there, but one of our assembly women has reached out and is interested in learning more and potentially carrying that bill.
Wonderful, wonderful. And I'm guessing that Samara Brook is probably on top of that as well.
Yeah.
Okay.
I also wanted to, I noticed that there was a question in the chat about what can the city do to address some of the tools that are lacking in the healthcare system. And truthfully, I'm not sure that I know the answer. I think I personally don't have an idea of the breadth of the problem. I think I know that, we're lacking options of where to bring people. I know that there's a shortage of professionals to do the work. But one thing I might offer is that, we could potentially work with the county to do a study to really understand what it is, that we're faced with. And also that, this is typically the county's space. The city is doing something very non-traditional by trying to address mental health, because that's typically done at the county. They get funding for their Office of Mental Health. It's not something the city gets any real state funding for. And so I think it would have to be in partnership with the county as they're part of the picture as well.
Yeah, I had wondered, I still think the Department of Recreation is a very odd place to have.
Recreation and Human Services.
Okay.
That was added on to make it make sense.
Yeah, right, exactly. But it doesn't necessarily make sense. And
when this was so important, and if the county wasn't willing to act at the time, the city stepped up.
Well, also just as a point of reference, it's Department of Recreation and Human Services, as Mary mentioned, which includes several human services units and teams. So it's the Crisis Intervention Services Unit, which is the PIC team, the Homicide Response Team, the Community Support Counseling Team. That's also Workforce Development. That's also AmeriCorps. So there are a number of human service programs, teams, and units that function under this bureau that the community may not be familiar with, but they do in fact exist here.
And it used to be called the Department of Recreation and Human Services at one point in time. And I'd like to just shout out the homicide response team, because I believe that's one of the reasons why PIC was able to scale up so quickly, because the homicide response team had already been implemented. And it was really just kind of shifting the model over to different responses.
so you don't see that, because I can imagine it ending up that it makes no sense for the city and the county to have parallel services doing the same thing, but you don't see it that way.
Something that is talked about quite frequently by my colleagues. I think every time we talk about PIC, it's, oh, and remember, this is something that the county should be at least funding us for. I think that there's a desire for the city to maintain some control over how our residents are serviced, as there is a different constituency from the county. But I think, there has been talk between the city and the county about, going forward, what that might look like. And those are just continuing. But I think because there's other state legislation floating, we still don't quite know how this is going to look. If we have state and regional councils in response, Daniel's law passes, if it's funded by Medicaid, be reimbursed by Medicaid, the county already bills for Medicaid and the city doesn't. So there's kind of a lot of open questions.
So can you remind me or tell us about what's in Daniel's law? What would that change?
Yes. Thank you for mentioning that. So creating state and regional councils, the council would make some decisions around mental health, how it's responded to, what police are allowed to respond to in terms of mental health. And then I believe it creates regional response teams. So I'm unclear how that would fit in with PIC, but that's honestly something I think we could do a whole forum about as well. There's so much in it.
Yeah. Okay.
I can mention,
Much more about that.
I did want to mention, if anyone's interested, it is Senate Bill 4814 and Assembly 4697.
Okay. So all of you, I'll ask this too, and anyone can speak up. This is really fantastic work that PIC is doing. That I don't feel like the whole city or county knows that PIC exists. So how far do you think we've come in the people who need to know that it's around, knowing that they can reach out?
I'm comfortable in feeling that we've made a lot of strides in our community education outreach, and it's something that we continue to do. We are constantly talking about the PIC team. We do probably 2 to 3 presentations on a weekly basis, countywide and citywide, talking about the work that we do. We are extremely pleased because we have people who call and request the PIC team directly, and they're able to do that through 211. And I think for us, that's our best measurement, is because the community is asking for us specifically and directly. And so that says to us that they know about us and that they're pleased with the work that we're offering. But Commissioner Green is definitely interested in us continuing the community outreach and engagement and ramping it up so that we continue to get the word out to the community, because as Mary mentioned, really it's ideal for us to divert as many calls as we can from the police department directly to the PIC team. So that's a work that's never ending, that needs to continue to happen. But I think that we've done a great job in doing that while we've kind of been getting things going and off the ground over the past 2 years.
So does it make a difference whether a person dials 911 or 211 or 988? Do they have the same probability of ending up with a PIC team, or is it? I just can imagine that the operators might have different training or outlook.
Well, they all have an assessment that they use that helps them to be able to triage where a call should go. I think that emergency services, the way it's set up to operate is a little different from 211. 211 and Goodwill is more counselor-based. They use kind of a different set of guidelines and questions around the information that they are trying to access from a person, whereas 911 has a more formalized system, I would say. 211, if someone calls, they even have the option of pressing a certain number to get the PIC team.
Mm-hmm.
So there are some differences, but I think that when it comes out in the end, from what we've seen and been able to tell, if the call can go to the PIC team, they're going to send it to the PIC team, because I think that everyone understands that, again, we're trying to let officers go to those calls that they should be at, and their area of expertise lines them up more for, versus a mental health crisis where emergency response social worker would be better suited to respond to.
Right, and 211 does not automatically attach RPD. That's something, once they give us the information, we will read all the information that 211 gives us, and we make the determination by saying, like, if the person is violent, if the person has a weapon, of course, we're gonna add RPD to that call. So as much information as they give us, the social worker, whoever is on call that specific day, they'll make the assessment to add RPD if necessary.
So promoting 211 is a really
Yeah.
important move. Yeah. Okay.
How-
Okay.
My question is, how has 980 entered into the picture? I know it's been out for a while, but I think that there hasn't been much promotion at the state level. Are we getting many calls from 988?
We're getting some calls. It
Yeah,
has,
not a whole lot. Yeah.
All right. Let me check the list of questions and see what else we might have. So I can imagine that being a 911 dispatcher has changed since creation of PIC. Do you feel like they're getting the retraining that they need, or so that they know how to make these calls? I mean, these decisions about who to call in?
I think so. I think we went through a training process as well, just to give them updated information when PIC was created. Since the implementation, of course, they had to add different like code codes, and how we code out the calls. So I'm sure they went through a training, and we send staff to training as well, just to make sure that we are all on the same page and we use the same type of verbiage.
and they are trained professionals, and they receive continuous training as well. So we're very confident in the work. 911 has been an excellent partner for us as well. And they are also very concerned in making sure that the team is being kept safe. And we're grateful that so far, our team has been safe. And I think that that's because of the precautions that have been put in place to make sure that that happens.
Right. And if we're on an extended period, on a call for an extended period of time, I'm just saying, like, more than a half an hour, they will just do a courtesy checkup just to make sure we're okay.
Great, great. Okay, so we just had something come in from Ernesto Porcari from Senator Brooks' office. He's got it changed to the bill number for Daniel's Law, so I put that in the chat for everyone. So getting back to the question that was asked a few minutes ago to Mary about what else the city can do besides hospital space. So I'm going to start by pointing this at Andy. So I know that you deal with people at every stage of their problem. So not when they're dialing emergency, but all of those days and weeks before it gets so bad that there's an emergency. So can you give us a quick rundown on what the investments would be that would avert some of this?
Yeah, I think, yeah, I'm happy to do that. I always love to tell people how they should be spending their money. No, I'm just kidding. But I think there's a few things that are really important. So we just opened a new shelter system that we learned over COVID that everyone having individual rooms. We originally did that just to stop disease spread, but then it turned out to be a really dignified way to house people. It also really helped with symptom management and being able to, deal with issues right there at the shelter. And I think then we worked closely with the county because we wanted to continue that. And the county, at least DHS Emergency Housing, was open to the idea of being really purposeful in the design of programs that you're paying for now. So if you have a program that is much more attuned to people's mental health issues and how to deal with crisis, then that's something you should fund. And I think you can, it's not easy work and not everyone wants to do it, but I think that can be something that can be spread to so many different levels. Like I love the idea of, say, county DHS being out in the community. They're talking about, you know, closing down St. Paul and getting back out into the neighborhoods. So oftentimes the vast majority of the work has to be done in the neighborhoods by building their capacity and their ability to respond, or their ability to have services that Leslie's team would need. You know, so if someone's there and we actually have mental health counseling at Montgomery Street, right down the road from Jefferson Avenue, people could access it much more easily and are much more likely to do it, or at home type work, or out in the street type work. We now have a medical practitioner that walks with us and he lances abscesses and writes scripts right there on the street. And the difference is night and day, you know, so someone who wouldn't normally go to the emergency room or would wait until they were brought to the emergency room in an ambulance and then be in the hospital for weeks can be taken care of easily in the community. So I think when we really think about tools, and obviously, Barbara, you know me, housing is
Yeah, I'm
critical.
waiting to hear that.
Yeah. So like safe, you know, housing that not every house had, you know, there's a lot of different ways to house people. Some people like community type environments. Some people like their own apartment, your own houses. But our lack of housing stock in Rochester is, especially low income housing, is appalling. And I think that's a nationwide thing. That's not just on Rochester. And so if you have unstable housing and you have dangerous housing at times, you're going to have a lot of crisis. I am sure the PIC team is responding to rooming houses more than anything else, you know, because it gets so wild in some of the housing situations that you know, that's where crisis bubbles up. So housing, of course, is a huge thing. I think meeting physical health needs, and then just the real basics, like making sure that people have easy access to food. We're good at that in this community, but we could be even better. You know, just food, clothing, all the real basics, and but doing it in a dignified manner. I think that we have a lot of issues where people don't trust systems anymore. And I can't say that I blame them. You know, there's been a lot of people that feel like a number, like a billing number. You know, they're just, you go in, you want to get help with RG&E and you come out with like 2 case managers, a therapist and all this stuff, and you feel like you're just getting billed, you know, and that there's nothing to you. And I think we need to really change how we do things for people and with people. So I think that's where a lot of it would help, that I think we're getting pretty good now. I've been pretty happy with the crisis response stuff now, knowing the limitations of it. You know, at least people are showing up. You know, the PIC team will show up. They may not have all the tools to help you, but they're going to be there. And I think so that's a great first step. And from that, we can figure out what are the tools that we need. You know, now that we're responding to crisis, how are we going to deal with crisis? Who are the partners we need? I think there's a lot of strength at city council and being able to really like push people to do the right thing. You know, that we are focusing our money on people that understand how to help people. And I think, you know, a lot of the county is starting to think that way too. It just takes time to get things done. And so that's a little bit, I could go on forever.
So
you know, you mentioned kind of the basic needs, and I think you're absolutely right. I know how I feel when I'm stressed, and you know, what we know about stress is that it doesn't only affect mental health, but also our physical health. And you know, I teach in the city school district as well, and I think it's easy to blame parents for a lot of the things that are going on with our youth. But the reality is that parents are stressed, you know, trying to work 3 jobs, not trying to avoid being evicted. How can they take care of their own mental health needs, let alone their kids? And then even, you know, my own children have had mental health issues, and finding them care is a full-time job.
Mhm.
And yeah, how can a struggling single mother really get there and find someone that accepts insurance and accepts Medicaid? There are just so many barriers, apart from the fact that there aren't enough mental health providers that are seeing children. The city school district has one psychologist for the entire district. So when you're looking at schools and getting kids seen, it's like, okay, June, maybe. So there's just a lot of barriers, both systemic in terms of just getting people's basic needs met, and in terms of who is available to help.
I've got a couple of questions about specific populations here. So do you find there are sufficient services for children and youth experiencing a mental health crisis? And a second one, are you able to partner with Willow Domestic Violence Center? So maybe Leslie would be the person to answer those.
That's the answer about the youth services, but I will say that Willow is a partner of Crisis Services. They've been a partner from the beginning of all three of our teams, actually.
As far as youth services, we do find ourselves responding to a lot of young people. Far as resources, we have lots of partners out in the community. We're continuously building relationships with partners. So if anyone know of anything, we constantly look for resources that we can help youth, especially young people. But we are successful at handling our call log as they're coming in. We have never gotten to a call where we just don't know what to do. I must say we have 20 plus highly professional PIC members who are, they specialize in just a wide variety of resources throughout our community. So that's helpful within itself, because a lot of them, some of them work here and have other jobs or have worked in other places in the community. So this is a very resourceful group of people who work together, and we kind of can come together. If they don't know something, we can ask it in a group. And I think 9 times out of 10, we can find something that would be helpful to the individual or family that we're servicing.
So do you end up doing follow-up like later in the day or the next day or whenever you're able to find out about that?
Absolutely. We try to offer resources while we're on the scene. So we do have a book that have lots of resources and it's continuously growing. But if we have to call someone back, we do a follow-up for everyone, just to make sure everything is okay, if there's anything else, because what we don't want to happen is we don't want the ball to drop. If we had, did a warm handoff to another organization or agency, we want to make sure that the dots connected and the ball doesn't drop for any reason. So if it did, we are able to make that phone call and see if we can be of assistance. Saying, like Andy said, you can't get into a therapist. That specific person we gave you has no openings for 3 months. So we want to give you some additional information on maybe someone else.
But we have found, Barbara, that one of the areas where we would definitely like to see additional resources is around youth services.
Mm-hmm.
We do have a few resources in the community that we can make referrals to for young people, but I must say we don't nearly have enough.
Mm-hmm.
Everyone talks about Center for Youth, but we all have capacity, and Center for Youth services mostly teenagers, but then you do have children who are younger than that, and they need somewhere to go as well. So we do have maybe 3 to 4 providers for young people, but from my understanding and what we've heard from partners is that there are never enough resources for young people. There are not enough beds, not enough services. And so we would love to see something happen where that capacity is built in the community. But we definitely, as Leslie mentioned, do not leave the scene without making sure that we've given some type of a resource to that person or the family member. And we do a follow-up within 24 hours, even if it's just a check-in call, to see if the person was connected, if they have additional questions or additional needs, because as Andy said, people have various types of needs. And what we might see coming out to the crisis is really just a branch on a tree where there are many different issues going on, from housing to food to mental health, whatever the case may be. So there are lots of issues, and we are, a very resourceful community. But we've got some work to do around how people can access those resources and how we can improve the delivery of those resources.
Absolutely.
We've got a question here. What kind of training do PIC team members undergo, and what credentials are they required to have?
So all of our teams are qualified. They, they're experienced. They have degrees. We have a very diverse group of individuals, licensed clinicians, therapists. You don't just have a high school diploma and get on the PIC team. So that's not what happens for us. We're very much qualified to do the work, and we do have continuous professional development that is mandatory and required on a monthly basis by all of our team members. So that is definitely not something that we take lightly. We know that it's necessary, but our team members have many specialty areas that we're proud of and we can tap into.
So my initial idea that everyone there is a social worker, was I off base? Or, I mean, is that mostly what you are, or all kinds of counseling? And
Yeah, in the counseling family.
got it.
Yeah.
Okay.
Alia, can you speak to the role of peers? Because that is one position where I think the credentials aren't the goal, it's more the life experience.
Yeah, so last year we had 3 peers that worked with us. We were in a partnership with Flips at that time. And this year, the mayor and city council has allowed us to have funding to hire additional peers. So we are in the process of bringing on some peers that will actually work for the city and the PIC team. And we're looking forward to bringing those folks on, 2 full-time and 1 part-time. So we know that they will, as Mary said, be able to bring in that lived experience that we found particularly valuable when we talk about our high utilizers or our frequent kind of folks that call us frequently, because we want to make sure that we kind of give those people an opportunity to receive the services that they need so that they don't have to continuously call the police or the PIC team, because really that's another one of our goals, is to make the connections, but for it to be a lasting and effective connection.
I wanted to shout out Jackson Nguyen, who asked that question. He's an alderperson in Ithaca, and I know they've been working with our PIC team to gain insight so that they can hopefully start one in Ithaca.
Oh, cool. Okay, we've got a question here. What resources are there to head off a crisis in the making? For example, people who have back rent and are facing homelessness, which you can easily imagine cascade into various crises. So
So, yeah, we've tried very hard with these different back rent programs, reaching people to help with that. 2 summers ago, we were on the corner of Frost and Jefferson Avenues, like, I think it was 2 or 3 days a week for about 4 hours. And we got to meet with tons of neighbors and do rental arrears and try and, hold off the eviction cycle. I'm afraid that, with a lot of effort by a lot of people, it still fell very short. Once the moratorium was lifted and people were able to start evicting, and they're just years of back rent not paid, or sometimes just a few months not paid. But being able to deal with that flood wasn't possible. So, the courts now, I know there's a huge backlog of people being locked out of their places. So eviction is truly a crisis, and we are in an eviction crisis. I've never seen as many homeless people or gotten as many calls as I have over the past 6 months or so. And you're right, that leads to crisis. I think that's why I work a lot in the homeless world, because I can't imagine not having a home and trying to figure out what I'm going to do with my children and how am I going to navigate all of this. And
how can you
I
do
like
your job? And
right. And I really like what Mary was saying, just if you think about your own stress, and then, everyone kind of has a certain level of coping skills. And when your basic needs push up too high and you're missing those, you're going to be in crisis because no one can handle it all. And I think, when we continue to kind of look at, fixing individuals and stuff, there are some real systemic issues that we need to fix. And one of them is the housing and eviction crisis, because you're in crisis when you come to my shelter. I guarantee you, there is no way around it. Even people who have been homeless throughout their lives over and over and over, it's still incredibly hard to become homeless. It's just a tough thing. So I think prevention programs are incredibly important, and they're really hard to deliver. What I've learned is that, there's a lot of paperwork, a lot of backlog, a lot of working with landlords. So every case becomes hours of administrative work, and we need to be able to streamline that more, because I know that's what social workers do. We do a lot of paperwork, but there's a point where we're helping so few because we're focused so much on paperwork. And so we need to figure out how to streamline these systems better, whether that's some sort of neighborhood vetting of landlords, knowing who's there and who's doing a good job as a landlord and who's honest. We should quickly be able to reimburse them. There's lots of different methods of doing it, but we need to really focus on those. And because right now everything feels like it's at capacity. Everyone's stretched to really thin. Everyone feels pushed. So it's hard to think in a way that would help the systemic side of things, because we're all just surviving right now. But I do think preventative programs, as true in everything from primary care, healthcare, everything, anything preventative is incredibly helpful.
Okay, we've got an interesting question here. Has there been a situation where PIC goes out on a call and there's violent or erratic behavior where the police are with you? Do you provide support that might prevent police from applying too much force? Has there been training and collaboration around this issue? Has there been a time where police response seems to be inappropriate? What does PIC have the authority to do?
Well, I'll let Leslie follow up, but I'm just going to start off by saying that our role is to advocate for our community members. And so when we come to a scene, we are there as concerned community members. And that's how we present ourselves. We're knowledgeable about the work and what we might see in our assessment, but we're there to work with the officers and to prevent scenes from escalating. And I think that at this point, and Leslie can talk about it as well, that the police allow us to talk with them, we share, we debrief, we talk about what we're seeing. But there are laws in place that do have to be followed. We don't enforce laws. We're there for support. We're there to bring the mental health aspect. But laws do have to be followed. And so that is what the police have to ensure happens. So we cannot supersede the laws that have to be followed. Go ahead, Leslie.
Yeah, we have been on calls where it has gotten physical, but we stand, we're not right in the forefront of, hands-on. A lot of times when we see hands-on, it's more so if someone's on drugs or, and going through something at that moment. They may be fighting with the police or something like that, but we will definitely try to engage with the person, but we will stay our distance and try to de-escalate just with our words and see if we can calm them down. But if it gets physical where they have to put someone in restraints, we will definitely be on a standby, just making sure it's just safe landing for the person just to get on the gurney and go to the hospital or wherever they're going to go to. Most times it's to the hospital.
So does your team wear a uniform or a shirt or a jacket that makes it evident to anyone who glances that you're the PIC team?
Absolutely. Yeah, we wear identifiable clothes. We do have shirts, we have jackets that has crisis services on it. Excuse me. We do carry our badges and they are visible at all times. Most of our team members wear their badges outside their coat. So when we go up on the scene, you will know who we are. Plus we carry walkie-talkies and we have just clipboards. So it's very evident that we are part of, you know, a team.
Okay, so it's great for Alia to say you're there as community members, but the police can identify
Oh,
immediately.
yeah, absolutely.
Yeah,
Absolutely.
yeah.
And once we're on the scene, that's the first person we have a conversation with, just a brief overview of what's going on. And then they'll just move out the way and let us take over.
Yeah, we have processes. We don't
Yeah.
just show up at a scene and just jump in. We've been requested to be there. And we also have a city vehicle.
Mhm.
So, I mean, there are no lights and sirens, but it clearly says City of Rochester on it. But if we're coming to a scene, the officers know we're coming. They're waiting for us. They're expecting us. They want us to be there. So
Yeah.
they know.
So, I mean, I'm just going back in my head to those horrible police cam views of Daniel Prude, and there was a dozen police standing around making
Without our
votes.
outfits and our coats, we normally don't wear, we wear just regular jeans and shirt, comfortable shoes, because we want to look as much as possible, least like the police. We don't want to have a lot of stuff rattling off of us. We don't like to have, you know, so we have to carry a walkie. That's just part of our protocol, you know, policies and procedures. But as far as wearing a uniform or, you know, looking alike, we want to meet people where they are, and we want them to know that we are relatable and we're here to advocate for you. When we come in looking like the police, they are automatically not gonna trust us or whatever the situation may be.
Right, but if you're on site and the police have restrained someone, you're there to say, do you really have to hold their head down?
Absolutely,
Yeah.
absolutely, absolutely.
And has that really happened, or just your presence has?
I can't personally say it has happened while I was on a call where someone had their head hold down, but have I had a conversation with the police? I would say yes. Yeah.
Okay, that's
But it's a respect thing because sometimes you may not know what you're doing, and we're here just to remind you that we're here to advocate for the community.
right.
Yeah.
Okay, good answers. Okay, here's a question. Do you have any optimism around the new local ideas for increasing housing for low income and attention coming from Governor Hochul on both housing and mental health resources?
Andy?
Any of you may speak up.
Yeah, yeah, well, I have to be optimistic or I think I'd quit, I guess. But I do think there is some opportunity for it. I also think, you know, I put a lot of burden on Mary and City Council to make sure it's done correctly. You know, I think that for so long we have allowed developers to kind of dictate how we do low income housing, and it becomes this kind of strange, affordable housing, and it doesn't make sense for the people that we're serving. So, but I do think, since it's coming from a place of government and it'll be coming into our municipalities, that we can guide the process with the developers and with the funding to make sure that it's truly low income housing and accessible for people who need it. So I do have some hope, just because, to be quite honest, I believe in Mary and the crew at City, and I think they can do these types of things. And I have a good feeling about the county lately too. They've been more helpful with us, and that's been nice, because that used to be another thing that would block. So I feel like we're in a good position to try to really do some good housing for people, rather than what we've done in the past. So I'm hopeful right now, and that makes me feel good. So we'll see.
All right, anyone want to jump on there?
Yeah, you know, I think ultimately we want people to be homeowners, because that's the most stable, affordable way to be housed. And so, you know, the city's implementing some programs around that, but it's not nearly enough. But with the affordable housing rental market, I think it's one metric to judge whether or not it's truly affordable is if it's being built in the 30 to 50% of AMI range. The AMI stands for area median income. And in the county, it's 91,000. 100% of AMI is 91,000. So the median income in the county is 91,000. In the city, it is 37. And so that works out to be about 41% of the area median income. So every time that we build housing that is, 50 and a 60, 70, we're not building it for the average Rochester family. So it's really important. And we have a severe lack of units in that range, more now than ever. If anyone's out there looking for an apartment right now, I'm very sorry, because there's not much in an affordable range for most people. You're looking at 2 bedrooms at $1,400, $1,500, and that's in not great neighborhoods. Or I won't say it that way, I'll just say struggling neighborhoods. It's really difficult out there, and we've got thousands of eviction cases in the pipeline. We're looking at a very serious crisis. And so this money comes at a time where it's desperately needed, but we cannot build more 60 to 80% AMI units, because that will not meet the need.
And who decides? So it was developers mostly who decided it?
It is developers who bring projects to us, and it is the mayor and city council that decide to put public funding towards it. There's also Empire State Development, and there's the state funding that they can apply for. But there are, I think a common line is, well, we can't make it pencil. That's the term, which means like they can't make the numbers work for them to make profit. But there are developers who are doing it, so it's possible. I think it just takes some creativity. Unfortunately, the way that our affordable housing programs work, it's a little bit difficult to get that low of affordability and be able to sustain it long term, but it is possible. We're having right now the old Cadillac Hotel, the units that are going in there are 30 to 50% of AMI. And that's a building that needs significant repair. So it's possible. I think we just have to be choosy on which projects we put our public money towards.
I think I'm glad that Mary brought up the AMI thing, because the wealthiest person we work with usually would be on supplemental security income and making about $11,000 a year. So there is no housing for that. And there also tend to be folks that are high utilizers of crisis services. And I think that's one of the reasons, is because there's just no place to be and you're living on the margins at all times. So that's the kind of affordable housing. And we do have some through ESHI, we need to work on that, and some other programs, but we really need to work to do better.
Okay, another question just came in. What about the city taking over existing properties, including abandoned homes and possibly repurposed schools?
Yeah, the schools are our property. The city school district doesn't own them. They use them and pay us for it. We're talking about, just discussing at this point in time the idea of requiring that when the city school district gives us those buildings back, that they become affordable housing. And there's, maybe it's not said in this way, but there's a hesitance of the city school district giving the buildings back because they don't want them to be turned into charter schools. And some of them have been. And so this will eliminate that feeling of maybe not wanting to let them go. And, their School 25 is a great example right now. The old School 25 on North Goodman Street, completely empty. That could be housing. That could be affordable housing right now. So I think the buildings we already own, land that we already own, we could be building on. And, I think in extreme cases, there's ways for us to use eminent domain for the public good.
So another thing about using former school buildings, you get neighborhoods resisting the closing of schools on the basis that a school is an asset. in the neighborhood. So if it gets repurposed as affordable housing, you could build in elements of community center that the school provided when it was a school. So yeah.
Buffalo has an organization called PUSH, People United for Sustainable Housing, and they converted the old school 77 building. It's an incredible project that they did. They made it senior housing on the second and third floor, I think, and then the first floor and the basement is community space. And then they powered the whole thing by a solar panel grid on the roof. So there's a lot of, I think, unique and innovative ideas that we can be using here, and I think projects usually work well in partnership, and whether we're partnering with private folks or nonprofit, there's definitely ways we can get this done.
Mm-hmm. All right, well, that's a pretty feel-good way to wrap up. Let me just ask if anyone in the audience has the last question. Now is a good time to put it in, but I'm gonna call on the panel if anyone has any final thoughts that they meant to share or have come up as they were listening to each other. Now is a good time to chime in with those.
I can just put in another plug for the Advocacy Day for Daniel's Law Wednesday. I will put the registration in the chat, but if anyone's watching on YouTube, it's bit.ly/Jan25 Daniel's Law is the link to the registration.
All right.
And there's buses that are leaving from Rochester, and they feed you.
Well, that sounds really good, doesn't it? Yeah, and there's always good camaraderie on those buses of like-minded people. You can make good friends and cheer each other up. Okay, well, I would like to thank each of you for being with us tonight. I've learned a lot, and I think it can guide us and the league as to what we will be working on advocating for in the coming year. So thank you all very much, and night.
Thank you.